All right, so the next thing we need to do is look at the actual administration sites that we can give an intramuscular injection in. So the first one and most common is the deltoid. So the deltoid is the muscle in your arm. For this injection, we're going to find the acromion process. The acromion process is basically the rounded part on the end of your shoulder. So you're going to locate that. And then that's going to be kind of the base of our triangle. So we're going to find that, and then it's going to make a line across there. And then we're going to find our axillary line, and we're going to form a triangle from here to here. And then in the middle of that is where we're going to give our injection. You may see that people are doing the acromion process and 2 or 3 finger breaths. Commonly, that is more difficult because you don't know if you're actually giving it in the correct place. So if you find the acromion process and find the axillary line and then make your triangle in the middle of that, then you know exactly where to give it. Our next site is a site that's not a site of choice, and it is going to be when you divide the top of the thigh from the groin to the knee in 2/3. And basically for this one, what we're doing is we are taking kind of the top of the thigh here, and we're finding the greater trochanter and the lateral femoral condyle, and we're doing this into 2/3. So 1, 2, and then right in the middle, you can see right in the middle there, that's where I would give my injection. That's the rectus femoris. We're only going to use this site if we have trouble accessing another larger muscle on a patient. Now, the site that is similar to find, only a little different location, is the vastus lateralis. So we're going to do the exact same thing in order to find the vastus lateralis. We're going to put this hand on the greater trochanter and this one the lateral femoral condyle. And then when we find the middle, we're going to go to the side, and then top, bottom, middle, right? So this is the top of the thigh, this is the bottom of the thigh, and we're going right in the middle. And that would be our vastus lateralis. And then finally, the other site that is most commonly used is the ventrogluteal. So for the ventrogluteal, we do need our patient in more of a side lying position. And we do need to be on the opposite side that we're injecting. So if I was on this side, then I would want to inject in this hip. Okay, so if I was on that side, I could inject on this hip. For this, you need your patient in a semi side-lying position, if at all possible. What you're going to do is you're going to find 3 landmarks. So the first one is that greater trochanter, right? So the greater trochanter is going to be the top of the femur, the top of the thigh area. And then we also need to find a couple of other landmarks. So we need to find the anterior iliac spine and the iliac crest. So the anterior superior iliac spine is going to be kind of the side of the pubic bone, whereas the iliac crest is kind of the rounded part. So for this particular patient, my palm is going to go on the greater trochanter. My middle finger is going to be pointing towards the iliac crest, and then my other finger is going to be pointing towards the anterior superior iliac spine. So I have this, and then you can see I kind of have like this little triangle here. This is where your injection is going to go for ventrogluteal. Depending on which method you're using, we have a traditional method and we have a Z-track method. The traditional method is where we're just going to inject the medication and pull the needle out. The Z-track method is where we kind of have a little track to prevent the medication from leaking back to the skin surface. So just for demonstration purposes, we've already got our med and we're going to just give it in our patient here at this site. So as we know, we're going to clean the site. We want to make sure that for the traditional method, we have the right size needle. And we're going to take the skin between our two fingers here and we're going to pull it taut. And once we do that, we're going to take the needle at a 90-degree angle and insert it, and then push the medication in slowly. We do not aspirate. You do need to pay attention to your facility policy about whether they require you to aspirate or not. And then I'm going to deploy the safety. And then I'm just going to go ahead and apply a little pressure. Might be just a little bit of blood, and then I can apply a Band-Aid. Now for the Z-track method. And again, we're going to clean our site. Different. For the Z-track method is commonly used for medications that could cause damage to the surface of the skin or stain it. So for the Z-track method, instead of pulling the skin taut between our fingers, we're going to take the side of our non-dominant hand and we're going to pull the skin towards us or away from us, however is easier for you. So we're going to pull it towards us, and then we're going to do the same thing. Inject at a 90-degree angle. Inject the medication slowly. Pull the needle out, and then let the skin go back. And basically, the point of that is, if you pull the skin and I inject, and then I put the skin back, the hole where I injected is not going to line up. It's going to kind of be this little track. So it's going to be harder for the fluid to get to the surface is the point of that.